Welcome. Thank you for joining us today. Hi, welcome. Thank you. We'll be getting started in just a moment, but in the meantime, if you'd like to introduce yourself in the chat, we'd love to hear where you're coming from today. Thank you for joining us this afternoon. Good afternoon. Welcome. Hi, everyone. Get started in just a few moments. I appreciate everyone introducing yourself in the chat if you'd like. And in the meantime, as I'll go ahead and get started with my short remarks here this afternoon. All right, so thank you for joining us. My name is Shelby Collier, and I'm the event coordinator for Voice, an organization that advocates for quality care options for residents of long-term care facilities and older adults in the greater St. Louis and Northeast Missouri regions. I am honored to be joining you guys today and hosting today's conversation on aging in place. And this is part 2, but if you didn't join part 1, that's totally fine. But today we'll be comparing programs and financials. We are so happy that Jen Morgan and Denise Dickens from New Horizons PACE are leading the conversation today and look forward to the great insights that they are about to give. Before we get to that, I have a few updates from us here at Voice, so just hang in there and we'll get started soon. So first, I want to say thank you to our education sponsors because their support allows us to do what we're doing here today and provide many educational opportunities to the greater community. So thank you to Eamon, Gantner, and Capriano, attorneys at law, Your Estate Matters, LLC, Enterprise Bank and Trust, Everspring Pharmacy, the FDC Foundation, and Infinium Pharmacy, and Quinn Estate and Elder Law. Thank you. And it is with their support that we can continue to provide free educational webinars monthly. And we provide this education to empower individuals and families to make better informed decisions about the continuum of care and better understand those personally and professionally connected to aging adults. So if you're interested in any of the topics on the screen and more, you can register now on our website. I actually have all of the links to everything I'm about to say in the chat already, but happy to share those again at the end. Next, we have a presentation on January 23rd at 10:30 a.m. at the Grants View St. Louis County Library branch. And this is on nutrition and dietary changes as you age. We will be joined by Jenny Dewey from the St. Louis Area Food Bank for this. And there's also a cooking demonstration in this presentation. So don't want to miss it. The registration is open on our website and is limited, so go claim your spot now. Next, we also have a free event, and it's the first of many at the St. Louis Public Library on February 5th at 11 a.m. And this one is on estate planning and preparing your family, and we'll be discussing all of the most important documents and the benefits of having those in place in advance of when you need them. This presentation will be at the Central Library location downtown, and we are excited to be joined by Nikki Mitchell from the estate and elder law firm Mitchell, Brown and Associates. So please come out and join us for that one as well. And finally, to round out our upcoming education, we have a professional development webinar on February 1st from 12 to 1. This presentation is available for continuing education credit for social workers and licensed nursing home administrators and other professionals who work with older adults. And it is all about the growing trends in substance use disorders in older Missourians and steps that healthcare providers can take to develop effective interventions in their care settings. So the registration is available on our website now. We'd love to have you there. And so I just have a few more reminders before I hand off the presentation to our speakers and introduce them. So there's closed captioning available, and if you'd like to turn it on, you can click the More button on your Zoom control panel and enable the captions. The webinar is also being recorded, and it will be sent to all registrants along with the slides and be made available to you via email and on our YouTube channel within the next 7 days. So we will also take questions. So please pop those in the Q&A or the chat box, and we will take those at the end. And without further ado, we have Denise and Jen. So Denise joined the New Horizons PACE team in 2019 and has been instrumental in developing and opening St. Louis-based program. Denise has been a nurse for 30 plus years and has a wide range of clinical nursing experience, including critical care, trauma, interventional radiology, and infection protection and control. Denise has served in executive leadership for the past 20 years, but she stays in touch with the true art of nursing, caring for others with empathy and compassion. We also have Jen Morgan, who is an experienced marketing and business development professional and joined the New Horizons PACE team in November of 2023. She previously served in several marketing roles at Christian Horizons, which New Horizons PACE is a subsidiary of. And she has been with the company and worked closely alongside Denise to launch and open the St. Louis PACE Center as well.
All right. Hi and good morning. I'm going to go ahead and start sharing the screen now. And then if everybody can just give us a nod if you can see the screen, that would be great. So welcome to Aging in Place Part 2, comparing programs. And let me move this little dude over so that I can see. And financials. Thank you for getting on today. Thanks for the thumbs up that you could see the screen. Appreciate it. So I'm Jen Morgan, the Business Development Director at New Horizons PACE, and I'm joined by our Executive Director, Denise Dickens, if she wants to wave and just say hi before we get started.
Hi, everybody.
All right. Thanks, Denise. All right, so we're going to go ahead and get started as we only have an hour. Let me put out a disclaimer. There's a lot here in this presentation. I will not attempt to say it all. I'll put more than enough information inside of the PowerPoint resource information that you can go back in the notes and read later and have for resources later. So I'll try to get through, but most certainly, if you have any questions, feel free to save those to the end and we'll get those answered. And then our contact information is also going to be at the end of the presentation. If you need to circle back with Denise or myself, we'll be certainly glad to talk to you and discuss any questions you may have. All right. So if all is well, we're going to go ahead and get started. A little bit about New Horizons PACE. We're located in St. Louis, right at Manchester and Kings Highway, kind of close to the main Barnes campus. We are a program of all-inclusive care for the elderly. Faith-based nonprofit. We are a subsidiary of Christian Horizons, who's a senior living provider serving older adults throughout the Midwest. We have about 9 senior living communities. This is Christian Horizons' first innovative senior program with New Horizons PACE. Definitely a different model. But we're glad to offer the service to the senior residents within the St. Louis city and county market. Our mission, which is shared with Christian Horizons, is to empower older adults in mind, body, and spirit through faith-led services. So feel free to visit our website at chliving.org. That's the Christian Horizons website, and you can also access the New Horizons PACE page as well through that link. It is a live link, so when you get the presentation, you'll be able to just click the link and go directly to our website. All right. So today, what we're going to cover is an aging in place population. We're going to kind of look at the stats there. Also, the term aging in place, what does that mean? We're going to take a look at nursing home costs versus in-home care costs. And then we're going to look at some aging in place options. We're going to get hopefully a good understanding of what is PACE. And then we'll be down to questions, or we'll answer any questions you may have. All right. So here's a graph that was shared with myself and Denise. She was a part of this presentation late last year, where it let us know that in the next 10 years, the U.S. 75 and plus population is projected to increase by over 11.7 million. And in the next 20 years, is projected to increase by over 19.6 million. So that's letting us know that the senior population in the United States is steadily growing and is going to increase over the next 20 years by 19.6 million. This is going to have significant implications for the senior living and the senior healthcare sector as it relates to not only the demand for housing and services, but also regarding the future of the workforce, which is very concerning as more people age and they are looking for care and services. We have to have the workforce, to be able to serve them. Also, to meet the needs of this growing senior demographic, there will be a need to innovate. That means to kind of think outside of the box and think of senior living and healthcare solutions that take into the account the declining ratio of those of working age. So during this same presentation, it let us know that at the rate the population is aging, the rate of young people being born and coming of age to work is like not meeting that need. So it's really something that the U.S. is looking at, because we have to make sure we have enough people working and being able to work in some of our senior living residences, whether it's assisted living, nursing homes, being CNAs for aging in place and things like that. So that is something that the U.S. is looking at. All right. So with the swelling number of older adults in the country, we can see greater demands for healthcare, as we are seeing that in-home caregiving as well as in assisted living facilities. And they said that the reason why is because as the baby boomers and people that have aged, they either don't have children or they don't have grandchildren caregivers. So then these particular individuals are, looking for options, senior living options, right? They don't have the in-family care that maybe you would have seen years ago. So by 2030, more than 1/5 of the U.S. population will be 65. Again, just stats to let us know, just to kind of get a ground level of the growing population. It says nursing homes are experiencing a shortage of staff, which we've talked about, and why, with the number of employees falling from 1.5 million to 1.3 million between February 2022 and December 2022. Another reason is the increased cost. There's been an increased cost of elder care. And so that's also a main concern in whether people feel really secure as they're aging. Also, I have some stats before I go on to this, I want to share some older adult demographics. It says 55.7 million adults age 65 plus living in the U.S. in 2020. This included over 30 million women and 24 million men. Nearly 1/4 of adults age 65 plus were from racially and ethnically underrepresented communities. So as we go on and talking about PACE, that's going to be important. It says there were over 104,000 people age 100 and older in 2020, and more than triple the number in 1980. So again, this is just letting us know that the number is continuing to swell when it comes to our aging population. So just kind of wanted to set the ground work there with exactly who we're talking about when it comes to aging in place. And why that's becoming a trend right now, and why that's desired at this point in time. And so then changing gears, can anybody tell me what is the leading cause of death in the United States? I don't see any answers coming up, but maybe Shelley can help.
We got one that says chronic illnesses, another one same for that one, and then another response of unintentional injuries.
All right. Well, I have to ring the bell for the two that said chronic illnesses. You're absolutely correct on that. The correct answer is chronic illness. So more older adults definitely are living with greater acuity, and they're using more services. Of course, that translates to more money that's being spent. It says chronically ill patients account for 81% of hospital admissions. 91% of all prescriptions filled are for folks with chronic illnesses. Also, they account for 76% of all physician visits. When it comes to cost, 90% of the average 3.5 trillion annual U.S. health budget is spent on treating the chronically ill. So one of the ways the nation is addressing and responding to these implications of the chronic illness is through innovative aging in place programs, which have shown to produce significant savings to healthcare costs through Medicare and Medicaid. So, and how are those savings seen? Through reductions in hospitalizations, and then also in long-term services and supports. So here I have on the slide that prevention and chronic care management through aging in place programs have been shown to produce significant savings, as I just stated. And then, of course, mostly through hospitalizations and long-term services and support. And this is a great infographic that kind of goes through some of that same information that you'll be able to resource after the meeting. So what does the term aging in place mean? At its basic level, it's used to describe the movement to assist aging seniors to remain living in the community with some level of independence rather than in assisted living facilities or in long-term care nursing home facilities. It is a growing field, right? One that's been shown to increase client satisfaction as well as reduce healthcare costs, as we just mentioned. It enables individuals to better manage their lives and, of course, stay connected to their loved ones, be a presence in their homes with grandchildren, and also just stay connected to the things that they like doing in their community. So that's desirable. It could be more cost effective than moving to a retirement home or assisted living community, which we'll kind of take a look at. So we're going to go ahead, and most people prefer to age in place because it enables them to, of course, better manage. All right. It says research suggests that many older adults want to remain in their homes while surrounded by loved ones in the community. In addition, a 2021 Home and Community Preferences Survey by AARP of over 2,800 U.S. adults found that about 75% of people over age 50 want to stay in their homes or communities for as long as possible. Hence why aging in place programs, are popping up and trying to be responsive to that. Over about 75% of people over 50% said that they would like to age in place at home. All right, so what is the cost? We'll move on to some of the costs comparing. What is the cost of nursing home care? Here on the slide, you see that this is by 2023 national median averages. It's about $8,000 per month for a semi-private room at a nursing home, and then for a private room, about $9,300 per month. And you can access some of these numbers. I put the link within the PowerPoint if this is something you want to go back to and kind of learn some more numbers here. It says actual nursing home costs will vary greatly, of course, based on three factors. The care and healthcare needs of the person, of course. Different types of skilled nursing will come at different prices. So that's one thing that we must understand. Also, the type of room, which here we see whether it's semi-private or private, that's going to also play, it's going to be a factor in the cost. And then the location of the nursing home is going to also be a factor in the cost. Cities tend to be more expensive, right? While rural settings tend to be more less expensive. So it depends on the geography, the type of room, and then the needs. Here, I kind of brought up what's the kind of let you see across the nation. These are some of the most expensive states for nursing home care. This is the top 10, if you will. And so I did provide the monthly costs for the room, and then also what the annual cost would be by these states. And then also you have the private room versus the semi-private room. So we can kind of take a look at those costs when it comes to nursing home care. I won't spend a lot of time here so that we can try to get through a little bit more within the time frame. Here's the most affordable states for nursing home care. So we see Missouri, that's where we live. So we're at the top of the list for the most affordable states. And you can see how those costs compare, private room versus semi-private room, and then in comparison to some of the other states that also made the list for the most affordable. So someone may ask a question, and many may ask you, why are nursing home costs rising? So there are several factors that I learned in doing this research. COVID-19 is a big reason why it went up. It says that that has led to sharp increases in nursing home costs due to decreased capacity and increased safety measures that now nursing homes have to observe. It has cost more to run a nursing home during the pandemic, and owners are passing on the cost to residents. So that's why COVID-19 made the list. Labor shortages. In May 2020, nearly 23% of nursing homes reported a shortage of skilled nurses in their facilities. And so what I've seen, just from my experiences, then they've had to have more agency in the buildings, and all of that costs more. So the need to fill this gap causes facilities to pay higher rates and increase that they pass on to residents. Increased demand. It says, as the population in the U.S. ages, people need nursing care more than ever. This increased demand leads to higher costs. Lastly, regulatory changes, especially in the wake of COVID-19. New CDC regulations are being placed upon nursing homes with regard to safety and residents' health. So while these heightened safeguards are likely a good thing, which we know that they are, we've lived through it. I've lived through COVID, working with Christian Horizons. And, these safeguards are definitely warranted and needed, are a good thing, yet they cost extra money to implement. So, of course, these and all the other things we discussed all kind of play a part in increased costs at nursing homes. So paying for nursing home care, how is it paid for? That's a question that we frequently have to answer. Most private health insurances don't cover long-term care facilities like nursing homes. People can purchase long-term insurance plans that will cover some of the costs, right? Long-term insurance plans offer coverage that healthcare plans like Medicare and Medicaid that they don't normally cover. So also, it's important to note that long-term care insurance is not an investment like life insurance, and it's a use it or lose it type of coverage. So that means if you don't end up needing the long-term care, then you are not going to get any money back. So people that are taking this out, have to also keep that in mind. But it is a way to have that sense of security that us or a loved one will be able to afford a nursing home in the event that it's necessary. You will want to have that insurance. When it comes to the cost of long-term insurance, you can expect to pay approximately about $3,400 a year, which comes to about $283 a month. So it's not a cheap coverage to have and maintain. So that's something that we have to be mindful of. Veterans have access to various long-term assistance plans, including help with covering nursing home costs. Also, Medicaid, while Medicaid does pay for nursing homes, it only pays for those people who require this level of care that meets the program's financial requirements. Also, again, I have a lot more information on paying for nursing home costs in the notes of this slide. So yes, feel free to go and, acquaint yourself with this. So it could help you maybe answer some of these questions if and when asked. So I'll move on here. So what is the cost of in-home care? So like nursing home care, the rates are going to vary, or the cost will vary depending on some factors. Here, the level of care that's needed is going to be a factor in the cost. The number of employees that are required to help you in your care, that's going to be a factor. If the care is overnight, that's going to factor in also your geographic location, because home care, just like nursing home, costs different, depending on where you are across the nation. And then your state's caregiver licensing requirements, sometimes it's more rigorous, and different fees and different things may cost more. So that may also play into the cost. It says some seniors may need caregivers in their home around the clock, helping with occasional overnight needs. Others, especially those with memory disorders or severe mobility and incontinence issues, they may need the aid of a caregiver several times each night. And so again, those are just things that will kind of drive up the cost of a person's in-home care. So what is the cost of in-home care? According to Genworth's Cost of Care Survey, the median cost for 24/7 in-home care each month, which translates to about 672 hours per month without insurance or discounts, is between $17,000 and $17,500 a month. If I'm reading that correctly, each month without insurance or discounts, and that's needing 24/7 care, about 672 hours per month. And again, that's that 24/7, when we talk about aging in place and comparing it to nursing home, which, a person, if they're in the nursing home, they need that 24/7 care. And so that's why it's comparing it at that level. If they were to try to get that same care through in-home care services, this is how much it would cost without that insurance or discounts. Okay. Also, I have a neighbor. Her name is Denise Dickens, and I can hear her talking over in the next office. And I hope she's not trying to speak and is on mute, but I'm just saying that out loud just in case. But I'll move on. So cost of in-home care here for 7 hours per week. I have this all broken down for your information. 7 hours per week is usually seniors who want to remain mostly self-sufficient. They just need a few hours. You see how much the cost that is, about $728 a month. And that's about a little bit over $8,700 a year. 28 hours per week. This means they're getting daily visits lasting about 3 to 5 hours. We can see how much that goes up. Now you're at over $2,900 a month. 44 hours per week, around the clock care or supervision. The caregiver works full time. Wow, we're up in the big numbers now. We're $4,500 a month. And then almost for those max hours, 168 hours per week, around the clock care usually involves 2 to 3 different caregivers coming into the home. That's where we're getting to that over $17,000 a month. So again, this is just keeping in mind these costs and really what it takes to take care of someone that wants to stay at home and give them really the level of care that they need to be able to do so. Here I pulled in some stats for you so you can see the affordability of in-home care by state. For 2023, you can see the most affordable states, their hourly rates, and then the least affordable states and their hourly rates. So you can see, for some states starting at like $17 an hour, where then it can go up to Washington, $31.63 an hour, or Minnesota, $33 an hour. So I'll pull those in for you guys to reference later. The national hourly cost for a home health aide in 2021, and again, this is 2021, so I'm sure it's gone up because we're in 2024, was $27 an hour. And that translated to over $5,100 a month, and then over $61,000 a year. So pretty expensive. It says the average cost, and I wanted to give you this, and this will be in your notes. The average cost of in-home care in Missouri is over $50,000 a year, which translates to about $4,100 per month, which is slightly lower than this average that was recorded in 2021. So is home health care cheaper than a nursing home? I'll pause there to try to see what we think. And let me know, Shelly, what's coming in. Is home health care cheaper than a nursing home?
Someone said, all caps, no. And another,
is that the only one?
Per week. There's another that mentioned depends on hours per week. Another says no. I personally would think that depending on the state of your home, what repairs you may have to make or adjustments you may have to make, or even if you have to move to, a single level home, could play a big factor into that. But a lot of people say it depends on how many hours and depends on level of care.
Yep, absolutely. All correct answers. Here it says, just looking at overall, if we're talking about 24/7 hour care needed, like if someone does need to go into the nursing home because they need that level of skilled care, if they were to try to stay at home and get that same level of healthcare management, then it's going to be more expensive to get that same level of care in your home. Again, you're going to need more hours and more people. So it says it's going to be more expensive with sleeping or non-sleeping visits than a nursing home. And then it lets you know sleeping visits cost approximately $12,000 per month for in-home care. Then an in-home care with non-sleeping visits has a median cost of about $17,000 per month. A private room at a nursing home costs about $8,800 per month on average. So we can see that, with that in-home care, the cost of that can start rising pretty quickly and adding up. So that's kind of how that panned out in comparison, nursing home versus in-home care. So now this takes us over into aging in place options. People can successfully age in place when they have resources that provide them access to timely and adequate health care, housekeeping services, companionship, transportation, safety, and social and physical activities. So these are things that, home care would afford a family or a person that wants to age in place. But again, of course, then it's going to start stacking up because of all of the things that have to be provided for that person. And then, the care as well as, the housekeeping services and all of that transportation, it starts to add up the cost. So as our population continues to age, there is a growing need for high quality, affordable healthcare services that can help older adults maintain their independence and continue living in their own homes. And so then this is where programs like PACE come in, and programs that are trying to have more of an innovative aging in place model to try to meet these needs because the cost of in-home care is so expensive that it's not affordable for the average person. And so then they wind up in a nursing center, maybe something, and they don't want to be there. So then you have the meeting of the minds, if you will, that come and say, well, is there a model or is there something we can offer people that where we can surround them with these services that would allow them to safely age in place in their homes and in their communities. So that's where we are now. So aging in place and programs like PACE and other aging in place programs are designed to provide individualized care to adults with complex medical needs. Again, adults that would typically need nursing home care, or they really do need that 24/7 support. Participants receive access to a wide range of services with these types of programs, including the medical care. It includes the rehabilitation that they would need, the social services, transportation. With PACE, transportation is included. And with programs like PACE, they are most often transportation is included. And all of this is delivered in the comfort of their own homes or in their center, which PACE has a care center where a lot of our services are delivered through. And participants are picked up with our transportation and brought down to the PACE center for their appointments with the physicians, for their rehabilitation if they can. Again, if they can't, then, that can be provided in the comfort of their homes. Programs like PACE, we also provide meals. We do breakfast and lunch, so they get hot meals here at the center. And for those that have any type of deficiencies like food or clothing or something like that, programs like PACE, we are able to meet those needs and sending people home with foods, and our social services kind of gets them connected with different other programs that can address those needs as well. And all of that, again, is within that Age in Place program. It most certainly is with New Horizons PACE. So the result of the participant or an individual engaging in a program like PACE is increased health outcomes. And why? With these programs, there's care coordination where the physician, the nutritionist or the dietitian, the therapist, we all work together to coordinate that participant's care. We help them to coordinate their doctor's visits, their specialist visits. They get the transportation they need to get there. So if they had trouble with transportation, now that's gone. So with PACE or with programs like PACE, we're able to make sure they get to and from their appointments. The nurses are now on call, so if they need something, we're able to address their medical needs more on a more immediate basis, and there's no waiting and there's no lack of care, if you will. So then you have those improved health outcomes. You have the reduced hospitalizations. And then you have the overall increased quality of care for the older adults that are participating in these programs. So as I alluded to, our program, the PACE program and programs like it, are more comprehensive. These programs are voluntary, so you can't make or strong arm anyone into signing up or enrolling in programs like PACE or in other aging in place programs. And then as such, if they get on the program and they'd like to disenroll, they can voluntarily disenroll as well. So that is in most participants' Bill of Rights to do so. Programs like this were authorized by the federal government. I want to tell you under Section 1932 of the Social Security Act. These are in your notes, also with a link to that act. So if you need to go back to it later, if you want to read up a little bit or learn a little bit more about it. And this act allowed states to elect to provide PACE services through their state Medicaid programs. So I'll say that again, states can elect to provide PACE services and programs like this through their Medicaid programs, which is how New Horizons PACE functions under the Missouri Medicaid program. So PACE is a national program, as I just stated, as it is authorized under the federal government under Section 1934. It's a national program. I included a map here so that you can see that there are PACE programs being carried out or implemented across the nation. There's more on the East and West Coast. You see us, you see our center right there on Missouri 1, but there are a couple opening up in Missouri, one in Springfield and one in Kansas City that's coming aboard. Supposed to be next year or this year. We're already in 2024. So later this year. So we're anticipating 2 new centers coming aboard. But as you can see, PACE is not just a Missouri thing. It's not just a Midwest thing, even though a lot of people aren't familiar with PACE and the PACE model. It has been around since 1971. It started in San Francisco by a dentist, actually, and a social worker in the city's public health department. They founded the Unlock Senior Health Services to help their clients in Chinatown, North Beach, age in place. And so Unlock, if I'm pronouncing that correctly, I may not be, so don't hold it against me if I'm not, is Cantonese for peaceful, happy abode. So just to give you a little background about where PACE all started and kind of how it just kind of expanded from there. So the PACE care model, just a little bit about that. We'd like to say that it is the gold standard of care for frail dual eligible elders. And when I say dual eligible, I just mean that they are Medicare and Medicaid eligible. Also, we are accountable for all the costs associated with our participants once they sign on to the PACE program. So we are both their healthcare provider as well as their insurance provider. So all costs associated with our participant is going to be billed through PACE. So we're that insurance provider. And again, it kind of works all in tandem with that whole coordinated care, because our doctors, our nurses, our rehabilitation team, our dietitian, everybody's working together. So a lot of times when there's a need that arises for a participant, we're able to get those orders through and get them seen and get care started immediately. So that's kind of the benefit of having that coordinated care model or that interdisciplinary team model for the participant. Also, PACE, of course, our model being an agent in place model, it supports people's desire to remain at home and is responsive to that. It also meets individual needs without fee-for-services restrictions. And so I'll go into a little bit about that, about kind of how the program is paid for. But of course, I want to just back up a little and just say, of course, that prevention and wellness are key factors to the PACE program, which is, that whole interdisciplinary team, and us talking on a daily basis really helps us to, make sure that certain things are prevented with the participant and that their wellness is always at the forefront. And if there's anything we can do, like if they need more therapy or anything like that, that can even go through the social aspect, we want to address those things quickly. Participants' needs are assessed and a person-centered care plan is developed. That's what we do. And we're able to respond to care needs within 24 hours and 365 days a year. Our nurses on call 24 hours. Also, the benefit of PACE as a Medicaid program lies in its unique financing structure in that and therefore there's a flexibility in delivering that comprehensive and person-centered care. PACE operates on a capitated payment model with programs receiving fixed monthly payments for each enrolled participant. So again, all of their care is going to be paid through that capitated rate or that payment that's made to us for each person. Because PACE is a capitated program, Medicaid financing is capped, is predictable and cost effective for the state. So that's why, the model works for the state. And I'll stop here to see, because Denise has been doing this, of course, in running the program. And she works for the previous PACE program in St. Louis. So I'll stop here to see if she wants to add anything about the payment structure, the capitated rate that could help to inform this team even better when it comes to the PACE care model. So I'll pause here, Denise, to see if you have anything to add before I move on.
Yeah, thanks, Jen. So PACE actually falls under the Medicare Advantage program structure. So a lot of our rules and regulations mirror that of the Medicare Advantage programs. But however, we are different than Medicare Advantage programs. So with our program, you can enroll at the first of the month, every month of the year. Medicare Advantage only has open enrollments for, I think it's 2 times a year. And that's when we get inundated with all the TV ads about, the 1-800 Medicare number and all of that. So we differ a little bit in that way, but our pay structure is similar in that whether, when you're in a Medicare Advantage program, you get a flat rate. And then that money has to, be appropriated across, for us, the lifetime of the participant. Most of our participants, once they enroll in PACE, the value is so great that they stay with us for life. We do see people, disenroll, every once in a while, but for the most part, they're with us for life. And so that's just a little bit about the pay structure. It's a little bit different from Medicare Advantage because we also become the primary care provider. Mm-hmm. So we do have physicians on staff with us that provide that primary care. And then we contract out with SSM for any specialty care. But basically, we're a full risk model. So our primary focus is to keep people healthy, engaged, keep their chronic disease under control, prevent emergency room visits and hospitalizations. And we can keep people active with occupational therapy and physical therapy for their entire lifespan. And so a good example is we do have an individual that's 101 years old, and she gets both physical therapy and occupational therapy. She's not in a wheelchair. We want to keep her active. And that's one of the ways that we do that is we're able to provide that special therapy to keep them up and active. Yeah, so you can, and Jen, I don't know eligibility, there was a question in the chat about eligibility. If you want to talk about that. Yeah.
So yeah, I just zoomed across 3 slides as what both Denise and I just talked about, kind of covered those 3. So feel free to go back, and there's some other notes again in there that kind of covers those. So we'll just move full speed ahead for the sake of time. As far as eligibility, here are the qualifications. The basic qualifications of the program is that participants must be 55 plus, live in our service area. And so the service area covers a wide range, of course, pretty much all of St. Louis City and some of St. Louis County for New Horizons PACE. But for PACE agencies across the nation, it's that language that you must live in the service area of the PACE organization, meet the state's nursing home level of care requirement. And then also you must be able to live safely in the community. So the PACE regulations do emphatically state, these qualifications. But also, again, the Medicare and Medicaid, it's the eligibility there would come from those programs. And then, we, of course, have eyes into whether the person has those in hand when they would engage the program to enroll. And let us know if that kind of answered your question. And if not, let us know if we need to go further into that.
Yeah. So typically, I'm just going to chime in for that, Jen. So typically, we enroll dual eligibles. So they would have both programs. If they have Medicaid only, then we can cover their health care as well. And you can also private pay, which is actually, pretty costly to private pay. If you have Medicare only, you are expected to pay the Medicaid share plus the Part D premium, as we provide all the medications as well. And so if you're Medicare only, to be in our program, it usually will cost you out of pocket $4,500 a month. But based on some of those costs that Jen was talking about, either private duty or, assisted living or nursing home, if you want to remain in the home, we're comparative with the costs for those. But I would say the majority of our members are dual eligibles.
Mm-hmm. Correct. And if you don't remember all that Denise just said, it is in the notes as well. So again, feel free to go back, and then you will have this recording, because we do know that a lot of these program structures, they are a little complex, and there's a lot of, details when we're trying to, explain, or let a family know about the program. So we're happy to be able to provide this information today and actually get it recorded so that, this can become a resource for you. All right, let me see what I have next. Okay, so these are some of the national stats that I pulled into the PowerPoint, just so that you could have on hand when it comes to the PACE organizations and them operating nationally across the nation. So PACE enrollment is over 70,000. And I want to say in counting. In 2023, it was a little over 70,000. There's 155 PACE organizations with 326 PACE centers. And all of this data is going to be as of October 2023. 96% of the participants in PACE, they live in the community. The average age is 76. It gives you the breakdown, men versus women. And it lets you know what services we help with, which we kind of went through that earlier, but you will have these nice graphics if you want to, again, refer back to them or share them. We talked about chronic illnesses. And again, this is really something that PACE tries to address through preventative health care. And then also, like Denise said, with wellness, really that's the key to our program. So it lets you know that how many of our participants have these or the top 5 chronic conditions that we see within our program. The trips, most, if not all, PACE centers have the transportation that's provided. We most, if not all, serves meals. So it's letting just really how great of a program it is, and at meeting these very real needs of senior residents throughout our communities. It's saving us dollars for all the reasons that we've discussed, with keeping people out of the hospital, and just helping them to stay as healthy as possible. So here's a stat here. States pay PACE programs 12% less than other costs of Medicaid services. States pay, and then in Medicare, payments to PACE organizations are equivalent to the predicted cost for a comparable population to receive services through the fee-for-service program, which we mentioned a little bit earlier. Here it is with of course, we're trying to keep people out of the hospital, keep them from going back to the hospital. So this gives us some stats when it comes to PACE. The lower hospitalization rate, decreased rehospitalizations, the reduced ER visits. It gives you those stats for PACE across the nation. Also, only 4.42% of nursing home eligible PACE participants currently reside in a nursing home. So that means that they most reside at home. All right. And then, people are satisfied with PACE care and services. 95% of families would recommend others to receive PACE services. So that's a good thing, especially when you hear things like PACE enrollees are less likely to suffer depression. Most have pretty rigorous social activities that go on at the PACE Center. We do our activities person. She plans a whole month full of activities for not only PACE participants, but a lot of them, their families are able to tap into as well. So, the satisfaction is up there in the percentage. So a great program. I'm happy to be a part of it, and happy to, again, have been able to bring this information to you today when it comes to how the costs compare nursing home versus in-home, and then with aging in place services like New Horizons PACE. So were there any other questions that came through the chat or that anyone would like to ask at this time?
Yeah, there are definitely some questions in the chat.
Nice.
In the Q&A. So one question was talking about what exactly does it mean about PACE being accountable for costs? I think it was on that first kind of slide talking about it.
Yeah, I can go ahead and take that one, Jen, if you want me to. Most of our participants don't have any out-of-pocket expenses. So in a traditional program, they may have a copay when they see a provider. They may have copay for prescriptions. Some prescriptions may not even be covered, and they have to pay out-of-pocket by a traditional Medicare program. So we cover everything, 100%. So if they go to the emergency department, we pay that. They don't pay anything out of pocket, including the ambulance bill. So really, we're just a full risk product, just like a traditional insurance program, with the exception that they don't have out of cost copays. They will, depending on their level of income, for Medicaid, which some of you certainly may be aware of what's called the spin down for if you're over the threshold of income, minimum income or maximum income for Medicaid. they may have to pay what's called a spend down amount. And so in that regard, they could have an out of pocket expense for that, but it's based on income, and that's determined by Medicaid based on their Social Security or whatever their earnings are. We don't determine that, and most people already have that determined because they're already enrolled in Medicaid and they know what that spend down amount would be. So good question.
Mm-hmm.
Awesome. Yeah. And just I want to tell everyone, I know it's 1:00, our projected ending time. There is just one more question. So if we can get to it, that's fine. And just wanted to let people know in the interest of their time, I want to be respectful. So, but yeah, the other question that there is just regarding the increase of 75-year-olds over the years ahead in the projection slides you showed. Are those projections only for the current population aging, or are projected deaths also considered? And in other words, are those projections net?
Okay, those are based off of census numbers. And so I also provided a link to those, then to that census information that gives those projections on how the population is aging. And so, I would say I don't want to speak as far as if they include the deaths and different things like that and get too specific there, but I did provide that resource. And so for the person that asked that question, please do so, hit that link, and then it'll give us more detail into, what they presented in those projections more specifically, if that's okay.
Yeah, definitely. Well, yeah, it doesn't look like there's any more questions in the chat. So just want to go ahead and kind of wrap up today. Go ahead and show my screen of your all's emails, and just want to say thank you to everyone for joining. We appreciate you coming out today in this cold weather, coming out virtually, and look forward to your responses in our survey after this presentation, which will pop up on the screen as we close. We'd love to hear your feedback. And once again, you'll receive the recording and the slides within about 7 days, and have our email and more resources are available at our website and on our YouTube, all of the following social media. So yeah, definitely we look forward to connecting with you and look forward to seeing you next time. So thank you.
Thanks, everybody.
Thanks, everyone. Have a great day. Stay warm.
Thank you. You too.